Exploring stem cell therapy as a treatment for autism spectrum disorder, ASD. In this video, we delve into the significant topic of stem cell therapy as a potential treatment for autism spectrum disorder, ASD. Autism spectrum disorder presents unique challenges, and traditional therapies may not always yield the desired outcomes for every individual. Stem cell therapy has emerged as a promising avenue, offering hope for improved symptoms and enhanced quality of life for those affected by ASD. Throughout this presentation, viewers can expect to gain a comprehensive understanding of how stem cell therapy works, the scientific principles behind it, and the latest research findings that support its use in treating autism. We will also discuss the various types of stem cells, the processes involved in therapy, and the potential benefits and risks associated with this innovative approach. Understanding treatment options for autism is crucial, as it empowers families and caregivers to make informed decisions regarding the best possible care for their loved ones. With the increasing prevalence of autism diagnoses, exploring all available therapies, including cutting-edge options like stem cell treatment, is essential. This video aims to provide clarity on the current landscape of autism treatments, emphasizing the importance of ongoing research and the need for accessible information. By the end of this presentation, viewers will be better equipped to navigate the complexities of autism treatment options, fostering a deeper understanding of how emerging therapies like stem cell therapy could play a role in the future of autism care. Join us as we explore this vital topic and its implications for individuals with autism and their families. Autism spectrum disorder, ASD, is a complex neurodevelopmental condition characterized by a range of symptoms and behaviors that affect communication, social interaction, and repetitive patterns of behavior. ASD encompasses various conditions, including classic autism, Asperger's syndrome, and pervasive developmental disorder, not otherwise specified, PDD-NOS. Each individual with ASD may exhibit a unique combination of characteristics, which can vary widely in severity and impact. Common traits include difficulties in understanding social cues, challenges in forming relationships, and a tendency to engage in repetitive behaviors or intense interests in specific topics. The prevalence of ASD has been rising, with recent estimates suggesting that approximately 1 in 100 children are diagnosed with the disorder. This statistic highlights the growing recognition of autism and the importance of early intervention and support. However, diagnosing ASD can be challenging due to the spectrum nature of the disorder. Symptoms can manifest differently across individuals, and some may display subtle signs that can be easily overlooked. Additionally, the overlap of ASD symptoms with other developmental disorders can complicate the diagnostic process. Clinicians often rely on comprehensive assessments that include behavioral observations, developmental history, and standardized testing to arrive at an accurate diagnosis. Despite these efforts, many individuals remain undiagnosed or misdiagnosed, leading to delays in accessing appropriate support and services. Understanding the characteristics and prevalence of ASD is crucial for raising awareness and improving diagnostic practices, ultimately ensuring that individuals receive the help they need to thrive. By shedding light on these aspects, we can foster a more inclusive society that recognizes and accommodates the diverse needs of those on the autism spectrum. Individuals with autism spectrum disorder, ASD, often benefit from a variety of traditional treatment options designed to address their unique needs and challenges. These therapies and interventions can include applied behavior analysis, ABA, speech therapy, occupational therapy, and social skills training. ABA is particularly well known for its structured approach to improving specific behaviors and skills through reinforcement techniques. Speech therapy focuses on enhancing communication abilities, while occupational therapy helps individuals develop daily living skills and sensory integration. Social skills training aims to improve interpersonal interactions, fostering better relationships with peers and family members. Despite the availability of these therapies, it is important to note that there is currently no standard treatment or cure for ASD. Each individual may respond differently to various interventions, making it essential for families to tailor approaches based on their loved one's specific strengths and challenges. Medications can also play a role in managing certain symptoms associated with ASD, such as anxiety, depression, or attention difficulties. While no medications are approved specifically for treating ASD itself, some can help alleviate co-occurring conditions that may hinder an individual's overall functioning. Behavioral therapies, including cognitive behavioral therapy, CBT, can also be beneficial in addressing emotional and behavioral challenges. These approaches emphasize the development of coping strategies and problem-solving skills. Ultimately, a comprehensive treatment plan often combines multiple therapies and interventions, allowing for a more holistic approach to supporting individuals with ASD. By understanding the range of traditional treatment options available, families can make informed decisions that best suit their loved ones, promoting growth and enhancing quality of life. Stem cell therapy is an innovative medical approach that utilizes the unique properties of stem cells to promote healing and regeneration in various conditions, including autism spectrum disorder, ASD. At the core of this therapy are multipotent stem cells, which are capable of differentiating into multiple cell types within a specific lineage. The primary types of multipotent stem cells used in therapy include mesenchymal stem cells, MSCs, and hematopoietic stem cells, HSCs. MSCs, often derived from sources like bone marrow or adipose tissue, can differentiate into various cell types, including neurons, which are crucial for brain function. HSCs, found in bone marrow, are primarily involved in the formation of blood cells, but also play a role in immune system regulation. The mechanisms of action of stem cells in treating ASD are still being researched, but several potential pathways have been identified. Stem cells may help reduce inflammation in the brain, promote neurogenesis, the formation of new neurons, and enhance synaptic connections, thereby improving communication and social behaviors. Additionally, they may modulate the immune response, which is thought to be a contributing factor in some cases of ASD. It is essential to clarify the difference between embryonic and multipotent stem cells. Embryonic stem cells are derived from early-stage embryos and possess the ability to differentiate into any cell type in the body, making them pluripotent. In contrast, multipotent stem cells are more limited in their differentiation potential, as they can only develop into specific cell types. Understanding these distinctions is crucial for comprehending the relevance of stem cell therapy in addressing the complexities of ASD and the ongoing research aimed at harnessing their potential benefits. Recent clinical studies have begun to explore the potential of stem cell therapy as a treatment for autism spectrum disorder, ASD, yielding promising findings that warrant further investigation. One notable study conducted in China involved the administration of umbilical cord blood-derived stem cells to children with ASD. The results indicated significant improvements in social interaction, communication skills, and overall behavior, suggesting that stem cell therapy may enhance developmental outcomes in affected individuals. Another trial from the USA focused on the use of mesenchymal stem cells derived from adipose tissue. This study reported positive changes in core symptoms of autism, including reductions in repetitive behaviors and improvements in social engagement, highlighting the potential effectiveness of this treatment approach. Safety is a critical consideration in evaluating stem cell therapies. Most clinical trials have reported minimal adverse effects, with participants experiencing only mild and transient reactions, such as fever or discomfort at the injection site. These findings suggest that stem cell treatments may be relatively safe for children with ASD, although long-term safety data is still needed. In addition to the studies mentioned, a systematic review of various clinical trials has shown that stem cell therapy can lead to improvements in cognitive function and behavioral symptoms in some individuals with ASD. However, it is essential to note that while these studies show promise, they often involve small sample sizes and varying methodologies, necessitating larger, more rigorous trials to confirm the efficacy and safety of stem cell treatments. Overall, the emerging evidence from clinical studies in countries like China and the USA supports the potential of stem cell therapy as a viable option for individuals with ASD, paving the way for future research and exploration in this field. The treatment process for stem cell therapy in individuals with autism spectrum disorder, ASD, involves several key steps designed to ensure safety and efficacy. Initially, patients undergo a comprehensive evaluation, including medical history assessments and diagnostic tests, to determine their suitability for the therapy. Once deemed eligible, the next step involves the collection of stem cells, which can be sourced from various tissues such as bone marrow or adipose tissue. Following collection, the stem cells are processed and prepared for administration, typically through an intravenous infusion or direct injection, depending on the specific protocol being used. Stem cell treatments for ASD are available in several countries, including the USA, China, Mexico, and Germany. These locations have established clinics specializing in regenerative medicine and stem cell therapies, often offering tailored treatment plans for individuals with autism. It is essential for families to research and choose reputable facilities that adhere to ethical standards and regulatory guidelines. Throughout the treatment process, patients receive comprehensive support to ensure their comfort and well-being. This support often includes pre-treatment counseling to help families understand the procedure and set realistic expectations. During treatment, medical professionals closely monitor patients for any adverse reactions and provide immediate care if necessary. Post-treatment follow-ups are also crucial as they allow healthcare providers to assess the effectiveness of the therapy and address any ongoing concerns. Additionally, many clinics offer psychological support and resources to help families navigate the emotional aspects of the treatment journey. The patient experience during stem cell therapy for autism spectrum disorder, ASD, is designed to be supportive and reassuring with a focus on comfort and safety. Clinics offering these therapies typically provide a welcoming environment featuring modern facilities equipped with advanced medical technology. Waiting areas are often designed to be calming, with comfortable seating and resources for families, such as educational materials about the treatment process. Treatment rooms are usually private and well-maintained, ensuring that patients feel secure and at ease during their procedures. Safety measures and quality assurance protocols are paramount in these clinics. Rigorous screening processes are implemented to evaluate patients' health and suitability for stem cell therapy. Additionally, clinics adhere to strict hygiene standards and regulatory guidelines to minimize the risk of infection or complications. Medical staff are trained in emergency procedures, and monitoring equipment is readily available to ensure that patients are closely observed throughout the treatment process. These safety protocols help to foster trust and confidence among patients and their families. Patient satisfaction rates for stem cell therapy have generally been positive, with many families reporting improvements in their loved ones' symptoms and overall quality of life. Feedback often highlights the professionalism and compassion of the medical staff, as well as the thoroughness of pre- and post-treatment support. Many patients and their families express appreciation for the personalized care they receive, which helps to alleviate anxiety and enhance their overall experience. By prioritizing a supportive environment, implementing robust safety measures, and maintaining high standards of care, clinics aim to provide a positive and transformative experience for individuals undergoing stem cell therapy for ASD. The affordability and accessibility of stem cell therapy for autism spectrum disorder, ASD, are critical considerations for families seeking treatment options. The costs of stem cell therapy can vary significantly across different clinics and countries, with prices typically ranging from several thousand to tens of thousands of pounds per treatment. In the USA, for instance, treatments can be particularly expensive, often exceeding $30,000, while clinics in countries like Mexico and China may offer similar therapies at a lower cost, sometimes $10,000 to $15,000. This disparity in pricing can create challenges for families, making it essential to thoroughly research and compare options before committing to a treatment plan. Affordability is a significant concern for many families, as the financial burden of stem cell therapy can be overwhelming, especially when considering the potential need for multiple treatments. While some patients may experience positive outcomes after a single session, others might require repeat therapies to achieve optimal results. This necessity for ongoing treatment can further strain family finances, highlighting the importance of transparent pricing and potential financing options offered by clinics. Moreover, insurance coverage for stem cell therapy is often limited, as many providers do not recognize it as a standard treatment for ASD. This lack of coverage can exacerbate the financial challenges faced by families, making it crucial for clinics to provide clear information about costs and payment plans. Ultimately, improving the affordability and accessibility of stem cell therapy is vital for ensuring that more families can explore this promising treatment option, allowing individuals with ASD to benefit from the potential advancements in care and support. In summary, stem cell therapy presents a promising avenue for individuals with autism spectrum disorder, ASD, offering potential benefits such as improved social interaction, enhanced communication skills, and reduced behavioral challenges. Throughout this discussion, we have explored the various types of stem cells used in therapy, the mechanisms by which they may positively impact individuals with ASD, and the encouraging findings from clinical studies conducted in countries like China and the USA. We also highlighted the treatment process, including the supportive environment and safety measures in place, as well as the importance of affordability and accessibility for families considering this option. As we conclude, we encourage viewers to delve deeper into the available resources and treatment options for ASD. Understanding the landscape of therapies, including stem cell treatments, can empower families to make informed decisions that best suit their loved ones' needs. We invite you to explore additional materials, research studies, and expert opinions to gain a comprehensive understanding of this evolving field. If you found this video informative and valuable, please consider subscribing to our channel for more content on autism treatments and related topics. Your support helps us continue to provide essential information to families seeking guidance. Additionally, liking and sharing this video with others who may benefit from it can help spread awareness about the potential of stem cell therapy for ASD. Together, we can foster a community that supports individuals with autism and their families on their journey toward improved health and well-being. Thank you for joining us, and we look forward to seeing you in our future videos.